And what about looking at some blood markers, looking at vitamin D, NGs per ml? There's a lot of controversy. Many years ago, 22 years ago, when I started functional medicine, in South Africa, the range was 30 NGs per ml to 100. And now all of a sudden they're looking at 30 to 20 to 40, in fact. And I'm sort of shocked. And, people are saying, what's going on here? If we look across the board, and obviously we're sitting at the 26-degree latitude here in Johannesburg, and it's mainly the clients I'm seeing, where should their vitamin D levels be about?
Yeah, obviously I consider 30 very low. Okay. And so the range of 30 to 100, which is what the labs use in America, 30 is probably 2 standard deviations away from the mean, which I think is horrible. And so we typically recommend at least 60. And, that's from sun exposure. Now, I'm not completely opposed to the supplementation in a short-term period, but understanding that you are completely missing the photonic energy and the bioactive metabolites from LDL cholesterol to 25 hydroxy vitamin D, which is down the line, you're missing all those biometabolites. So I would say 60 and above, and mine currently is about 75, and we're in the middle of winter here. So, but typically what I do is I take a couple of trips south, during the winter for a week to supplement with a little better UV. I'm at the 34th latitude, so we get some UV index about 5 or 6 here right now. So we're outside of vitamin D winter, but depending on where you are, you may have to do things a little differently, but you have to pay attention. Vitamin D is extremely important. As you know, most of the chronic diseases, all of the epithelial cancers, they're all associated with low vitamin D. And if you make vitamin D from the sun, then you look at the studies out of the Swedish melanoma study, which shows that all-cause mortality is increased by sun avoidance on the order of moderate to heavy cigarette smoking. So we're doing a great disservice for our society by telling them to avoid the sun, to wear sunscreen, sunglasses, hats. I mean, you need a proper dose of sun. I mean, there's no question about it.